So good morning and hello everyone. My name is Sharon Jacoby. I am Alma's Global Clinical Training Manager, and I am delighted to be hosting this live webinar today with our special guest, Dr. Fernando Urdiales, our long-standing and good friend, KOL, and internationally renowned doctor. So we will start by presenting the Alma's PrimeX body contouring device together with our patented technology. And then we're going to have the unique opportunity to hear Dr. Urdiales describe his recent in-depth clinical study using this technology. So the study was published earlier this year in the Journal for Aesthetic Plastic Surgery. And as we will hear soon, as well as demonstrating fantastic results in body contouring and tightening, we can see impressive diagnostic tools we used in this study to quantitate these results. And then we'll finish our webinar by answering any questions that you can write in the chat box during this webinar. So let me introduce you to Dr. Urdiales. He has over 30 years experience in aesthetic medicine, and throughout his career he has combined his serious work as a doctor with collaborations with associations, with companies, teaching, congresses, presentations, and many awards. He is a medical director of 2 clinics, the Miramar Medical Institute in Malaga and Marbella, and is an expert in facial rejuvenation techniques, including many techniques, but including lasers and energy-based devices. And as I mentioned, throughout his clinical practice, he continues to teach and to do serious research and publish his work. So thank you, Doctor, again for joining us today. So let me start with providing you an overview, just a brief overview outlining the Alma PrimeX and just some highlights of his technology. And then I'll pass you over to Dr. Urdiales. Okay, so for those of you who don't know, this was a device that Alma launched, I think, over a year and a half, 2 years ago. And it's a device dedicated to body contouring. It has 3 applicators and combines Alma's patented ultrasound technology, non-focused ultrasound technology, together with Alma's unique radio frequency technology. In terms of indication, as I mentioned, body contouring, reduction in adipose tissue volume, and improvement in cellulite and skin laxity. What are we targeting with the Alma PrimeX? We're targeting the subcutaneous fat, the stubborn fat that lies just underneath the dermis. We're going to be targeting collagen throughout the dermis with our radio frequency heating, and we can also target that stubborn indication of cellulite. Okay. Let's start with the ultrawave. So the ultrawave is an upgrade or an improved version of those of you who are familiar with the ultra speed. It is Alma's patented ultrasound technology, which is a blend of different kinds of ultrasonic waves. What's important to mention is that it's non-focused and not painful. So what has Alma done to the ultrawave or to the ultra speed to upgrade it to the ultrawave? And essentially there are 4 new features. And this really, as Dr. Urdiales will confirm, improves the results in terms of efficacy, faster treatments, and quicker results. So how have we done this? Well, we've introduced 4 developments. The first one is this cone shape here. And again, what's important to remember, with ultrasound technology, we get a lot of loss of the energy on delivery. Okay, a lot of the energy is lost into the room. With the cone, or the adaptation of this hollow resonator, we have managed to improve the efficiency of delivery of ultrasound, or reduce the loss by over 30%, okay? Meaning faster treatments, more effective treatments. And this is just, as I mentioned, due to the shape of the resonating box. We still have the guided land waves that transmit through the generator, which go through the carefully developed sonotrode, an 88mm large sonotrode with an alloy of various metals for this optimal delivery. And we've managed to improve not only the efficiency of energy, but also not creating any hotspots and amplifying the energy, thereby resulting in a deeper transmission of the ultrasound energy. Another very important feature of the ultrawave is the introduction of the impulse feature. So what is impulse? Impulse means that we can adapt or we can adjust the way we deliver our ultrasound. Now we can deliver this ultrasound continuously, pulses, into the patient, delivering heat and energy, or we can pulse the mode of delivery. And you can hear this in the applicator for those of you that have used it. By pulsing the energy or delivery of the energy, we are resulting in creating minor shock waves at the beginning of every pulse, okay? And these minor shock waves have shown again to improve the efficacy of this energy in treating indications such as cellulite. We're mechanically disrupting membranes, and we are mechanically introducing the influx of lymphatic solutions and enhancing lymphatic drainage. And we have seen great results around the world of doctors using this impulse feature, especially on cellulite for the thighs. Now, the vacuum is another introduction, another new technology, and this again improves the loss of energy. So you've got that firm contact. It allows for the therapist to have a more smoother and more effective treatment without to maintain that skin contact with the sonotrode. And together, this will reduce the loss of energy. And again, we think this contributes to the improvement in our clinical results, the remarkable clinical results that we have seen with this applicator. And then we have the React feature, which was present previously. Again, this has been improved. This means there will be a resonance feature throughout the treatment, which will constantly be adjusting the power and the energy to the sonotrode throughout the treatment, depending on the patient's skin, temperature, and this is something that is done behind the scenes while you're treating, but again will increase the lifetime of the device and also the treatment. So let's just take a look at a brief animation summarizing everything that I've already explained to you. Okay, so there's no sound here, but it's just music, and you can see that we're showing the mechanism of action in an animated way, disrupting the adipocytes. Dr. Fernando will talk more about this, resulting in a reduction of this adipose tissue. And as I mentioned, really remarkable results for the abdomen, men, women. Again, you can ask questions at the end but we can talk more about treatments later. Okay. So a few words about the unibody technology, and then I will pass it over to Dr. Urdialis. So the radio frequency technology is present in our unibody applicator as well as our hands-free accentuate applicator. And this is different to other radio frequency technologies on the market in the way that we first of all work at a very high frequency of 40.68 megahertz. And this will create an immediate electric field in the tissue, affecting any tissue that contains water. And due to the polarity of water molecules, passing this electric field through the tissue will result in the rotation of water molecules, which in turn will create friction. And this results in very, very fast, and what's important, no hotspots, uniform heating of the surrounding tissue. And as we know, in order to create a tightening, we need to heat for 10 minutes at a high temperature to denature the collagen, to stimulate heat shock proteins, and this is something that we know that our applicator can do very well. We have a phase shift technology to adjust for the depth control throughout the dermis down to the subcutaneous level, and we constantly monitor skin temperature to know we are in a therapeutic range, and all of this with no discomfort to the patient. Okay, so Dr. Urdialis, I'm going to pass it over to you now to continue. Thank you.
Okay, thank you, dear Sharon. Next one, please. Thank you, dear Sharon, for your presentation. Thank you, everybody, for to be here, people and friends and guys from all the world. We're very happy to introduce, before, please. We're very happy to introduce our study with this new technology. Everybody knows that we are working with Alma since many, many years ago in the development of the ultrasounds and in the development of the radio frequency for this indication. So when you are treating when you are treating fat in the body, everybody, doctors know that fat is in the tissues in form of triglycerides. Okay, then the triglycerides are into the cells. When you are using ultrasounds or when you are using radio frequency, you produce a fat cell disruption. This fat cell disruption produces that the triglycerides go to the blood, and the cell membrane content goes out. So the action of the lipase produce that triglycerides goes to fatty free acids and glycerol. And glycerol is a component of the triglycerides that this is water soluble. So for this reason, this water soluble, it means that it could be eliminated by the urine, only the glycerol, but the free fatty acids is linked by the albumin and goes to the liver. So it means that we recommend to the patients that at the end of the session it's necessary to do any kind of exercise, for example, walking for 5 minutes or something like this, because this fatty free acids linking to the albumin is going to the liver, and the metabolism eliminates this when you are using, when you are doing a little bit of exercise after the session. So the water level, the urine levels of glycerol, we can mean in the urine as well after these sessions. Okay, next one. Think about that when you are using ultrasounds, you produce this kind of ultrasound, this unfocused ultrasound. So there are two kinds of ultrasound, that this is with mechanical effect and with a thermal effect. So the mechanical effect of this kind of ultrasound is higher than the thermal effect. For this reason, you produce a mechanical and thermal stress in the tissue, in the subcutaneous fat, and you produce a damage of the adipocyte. The damage is produced by cavitation about the mechanical effect of the ultrasound, and the little bit of the heat produce apoptosis as well in this situation. So you obtain a lipid leakage, you obtain a reduction in the cell volume, and apoptosis. That means that this is a silent cell death. The silent cell death means that the final result of the treatment you obtain in 1.5 months or in a couple of months when you have just finished your treatment, and at the end you obtain a reduction in adipose tissue volume in the patient. Next one, please. What about the radiofrequency? All of you knows that how works is radiofrequency. Radiofrequency produce an increasement of the temperature, and this produce a stimulation of the tumoral growth factor beta stimulus, and it produce apoptosis in all the fat cells. Because this increasing stimulates the production of the head shock protein 47. We know this seen many years ago, and this stimulates the synthesis of the procollagen type 1. Procollagen type 1 is necessary for the production of the total collagen. This is a very interesting indicator that appears in urine, is the presence of the propeptide amino terminal of the procollagen type 1 in urine, that you can do a measurement in urine when you are producing collagen, not only with radiofrequency, with all the thermal devices that increase the temperature and increase the head shock protein 47. So this is very interesting, for example, to explain how was the collagen production when you are using radiofrequency. Next one, please. Unipolar mechanism of action is well known for all the people who are using Alma radiofrequency. Alma radiofrequency have 40.68 megahertz. I think that this is the number of the telephone in Alma. You know, this is the only device that have this kind of frequency, and the action is producing increasement of the temperature and collagen is tightening as well by the reactions that we talked before. Okay, next one, please. Vasodilatation is another reaction that produces when you are using deep radiofrequency into the tissue. So you produce increasing of the blood vessels, increasing of the circulation in the area, and for this reason you feel that the nutrients go assisting to the tissue, and the reduction of the cellulite and wrinkling in the area, and producing of the collagen as well. Next one, please. Okay, this is yours, Sharon.
Okay, thank you. Yeah, I couldn't unmute. Okay, so thank you for that explanation on mechanism of action. I know we get lots of questions on, you know, how our technology works, so that's fantastic to hear. In terms of practical treatments, so you know, we can use these individually, or we can package them as combinations or sequential treatments in one session. And I think, you know, Dr. Urdiales will talk about his combination. We have another publication just on the ultra wave, but there are different levels, and this depends on the patient's indication and time and money and what they wish. But we have a classic, so just the ultra wave, which really focuses on the circumference reduction, 20-minute treatment, 4 sessions, 1 to 2 week intervals. We can then combine an ultrawave treatment followed by a hands-free radio frequency treatment, which really, gives a therapist a break for 30, 40 minutes or however longer is needed. And again, fantastic results using these combinations. And then the combination of the PrimeX Premium, which is what Dr. Fernando is going to talk about in his study, and that is using the ultrawave immediately followed by the radio frequency unibody. And I think this really gives the ultimate in circumference reduction and skin tightening. So I'm going to pass it over again to Dr. Odialis to talk about this very, very in-depth, interesting study. So, yep, over to you again.
Thank you, Sharon. I think that this is after and before study, because this study was made in COVID times, so we select 20 patients, and finally it was done with 15 patients at the end by COVID reasons. So I think that this is a very interesting study, because the magazine was one of the most prestigious magazine in our world. It was in aesthetic plastic surgery. This is a surgeon's magazine, So this is a non-surgical combination of different technologies to reduce body contouring, who has been published in a surgical magazine. So think about that. All the surgeons that accept this publication saw that the results was a very improving result, because this is a non-surgical activity. This is a non-surgical treatment to reduce. So this is very important in our world to have the possibility to do this kind of publication in a surgeon's publication. Okay, next one, please. Next one. Okay. The objective of this study is to assess the efficacy and safety of non-invasive body contouring patients with local obesity in abdominal and hips area at the same time. The method was we chose to do only 4 sessions, 1 week session with Alma PrimeX that all of you knows. And we use a unipolar radiofrequency in the abdominal area and ultrasounds in the abdominal area at the same time, first and second, and we use ultrasounds only in the hips area. In the hips area, we don't use radiofrequency, and we use only ultrasounds. About the radiofrequency, was applied only in the abdominal region in 15 sessions, more or less, with accumulated energy about 70 kilojoules. And ultrasound was applied in both abdominal and hip regions. But hips was only, as I told you before, only with ultrasounds, with a power level more or less of 8, with a frequency of 10 Hz, with high vacuum utilization of 15 to 20 minutes, more or less. Next one, please. Have a look about the technical details of the PrimeX, because when you have a PrimeX, the radio frequency is the same that you have on any other device of accent device, okay? But the ultrasound is higher, and the results that we obtain with ultrasounds are high because the energy is higher. And Sharon explained before how is the new technology of ultrasounds that we can use. It was called ultrasound because are not focused ultrasounds, as she told before, and this is much more intensivity ultrasounds than before. So the results that we obtain with ultrasounds are much better than what we obtain with any other device that have ultrasounds of Alma with this technology. Because we have new technologies, we have vacuum, we have new cooling, we have more intensivity, we have a different frequency, and for this reason we have better results and quicker results than we have before with ultrasounds. Next one, please. Have a look that in all the patients we did ultrasounds echography of the abdominal area in the hips area as well. So I think that the echography is a very interesting technology to in our treatments to decide if we do the treatment or not, because it's necessary to do a measurement of the thickness of the adipose tissue in the supraumbilical area and the infraumbilical area. With this technology, we can see any other pathologies of the abdominal area, like, for example, diastasis of the rectus. We can see some hernia, or we can see any other pathologies that people could have in the abdominal area, for example, after the pregnant or after obesity people, because we can do a diagnostic about if the most part of the abdominal area is from visceral fat, or the most part of the abdominal area is for the fat that you can find between the muscle and the skin, because this is the target of the treatment. The target of the treatment will be the fat that you have between the muscle and the skin. Okay, have a look, for example, in this A and B that you have in an infraumbilical area. This is the thickness of a patient that we did a measurement between the muscle and the skin, that you have 2.45 centimeters, and after the treatment you can have, for example, 1.18 centimeters. And a supraumbilical area, for example, at this time, this patient had 1.76 centimeters, and in the right side you have 76 centimeters. So you can see not only the reduction of the fat in this area, you see the fibrosis, you see much more collagen in the area, and it means that you will have more skin tightening in the area. Next one, please. Have a look. These are the photos that we obtained in other patients. For example, in the left side, you see after and before. You see, for example, the measurement of the infraumbilical area in this after and before, and the reduction, a supraumbilical area after and before, for example, you see. And have a look that this is very improvement, the increasing of the collagen in the area, not only the reduction, because people ask about, okay, if you reduce fat in my stomach area, what means in the skin that you have of the umbilical area? So it's necessary to do a skin tightening treatment in this area as well at the same time as the reduction. Okay, in the E and F photos, you see, for example, the hips, and you see the reduction of the hips. Think about that. In these areas, we use only ultrasounds, and we did not use radiofrequency. For this reason, you see that the collagen improvement is less than in the photos that we have used radiofrequency before. For this reason, you use a big reduction of the tissue, of the fat tissue, but you don't increase a lot the collagen synthesis in the area. So it's very clear that when you are using radiofrequency, you increasing the collagen and produce much more skin tightening in the area. Okay, next.
Doctor, could I just ask here, what was the reason you didn't use the radiofrequency on the hips?
Okay, it was only a methodology of the work, because we like to do a measurement of the fibrosis in the area using or not using radiofrequency. For this reason, I think that ultrasounds are totally different, and they are indicating for the reduction, and radiofrequency are indicating for the collagen.
Okay. Yeah, that's great.
Okay. Have a look at the photos, because these are 2 dimensions photos, and all the patients are very satisfied, because we never treat obesity people, because obesity patients are contraindicated with this technique. Think about that. The most part of the obesity people have a lot of fat in visceral fat, and visceral fat is our enemy, because this visceral fat push the muscles front, and for the reason we don't obtain good results in this patient. The very good results in these patients is the patients that are in a normal weight, more or less, or have a very little overweight, and they have a lot of fat in the supraumbilical and infraumbilical area and in the hips as well. For example, have a look this patient that with after 4 sessions, she have 374.24 cc's less. This technology is a Vectra H2 technology that could produce, could do a measurement of the losing of the volume that you have before photos. That this is very very good for us because it's very easy to do the measurements. Obviously, when you are not doing a surgical procedure. Next one, please. Have a look, for example, in a zenithal view and caudal view that we did in all the patients. For example, that in this patient, for example, you can see the reducing in the left area, and in the first patient that you can see up. This is a man that lose, for example, 442.8 less cc's in all the abdominal area, and in the lower photo, in the caudal projection, you can see that she lose, for example, 326.6 centimeter cubics in the area. So this is very interesting to do a measurement of the volume that you can reduce in all your treatments. Next one, please. These are 2D photos. This is a slim boy that have a big thickness of the fat tissue that in the supraumbilical and infraumbilical area. Okay, this is the reduction. And have a look about the skin tightening in the abdominal area as well. Next one, please. And you see that the yellow areas are the areas that reduce the volume. This is with volumetric Vectra H2 technology. This is to do the measurement of the volumetric losing with this technology. And these are the areas that lose more and you have less volume. Next one, please. We can do a measurement of the losing of these volumetric areas, for example, and after 4 sessions, this patient lose 442.8 cc's. And not only this, the retraction of the skin is with a very good improvement as well. Next one, please. So you see 404.8 cc's less in all the area after 4 sessions. Obviously, it's necessary to indicate to these patients, and over our study it was like this, not increasing the weight and not losing the weight. There are some patients that come to the clinic to reduce this area, and they need to lose a little bit of weight at the same time, so they use diet at the same time, and we are doing this kind of treatment at the same time that they are losing, but with a very little overweight. Think about that, we never treat obesity people with this technology. Next one, please. So I think that the gold standard to reduce volumetric areas with a non-surgical technology could be this. And this is the non-focus ultrasound and unipolar radiofrequency. Unipolar radiofrequency is much more important when you have a little bit of flaccidity or laxity in the skin. It's important during the treatment not have changes in the weight and because if you get weight, you increase the visceral fat. Okay, so the dietary control is very important in these patients. And in our study, we think that normally the patients who need to reduce their volume need to reduce the hips area as well. So I think that it could be necessary to treat both in the same session. And the satisfaction of the patients was very high. 46.7 patients who were satisfied, and 40 patients are very highly satisfied with the results. Next one, please. Think about, have a look, for example, about the measurement of the weight, that it was the same weight more or less, and the percentage of fat mass in the abdominal area was the same, but the reducing, the average of the reducing was infraumbilical with 1 centimeter more or less in 4 sessions, and supraumbilical 0.9 centimeters. This one, please, in 4 sessions. Think about that. We are doing now, in the most part of the patients, 10 sessions, from 8 to 10 sessions, and we increase the time between sessions after the 4 or 5 sessions in all the patients. We are doing the sessions between 1 month, 1.5 months, more or less, when they have done more or less 4 or 5 sessions. Have a look, these results in abdomen and hips in 10 cases, for example, that the weight was more or less the same. The percentage of fat mass, it was the same. We did the measurement of the percentage of fat mass with Tanita 180, and this is a technology to do. This is impedantiometry technology to do measurements of fat mass. Have a look that the infraumbilical area, when we are treating abdominal area and hip area, is 0.76 centimeters, and in supraumbilical 0.61 centimeters, and in the hips area is higher, the losing only with ultrasounds, because we use ultrasounds only in this area. Okay, next one. So we are treating patients with body sculpturing. Think about that. We have a big clinic and we have surgery area, and we are doing a lot of laser liposuction, and we do all the technologies with surgical and surgical technologies. In my opinion, I think that this is, in all my life that I treat many devices, in my opinion, this is the best. We have non-consumables. We don't treat obese patients. The phase shifter, I think that is a very improvement technology that there's applied to the radio frequency, and this is very interesting. This is fantastic that if we compare with the radio frequency that we had before, the average reduction of the thickness in the abdominal tissue was 0.97 and the supraumbilical 0.89. And the average of the thickness reduction in the hips was 1.1 centimeter and 0.52. Think about that. The most part of the hips are not symmetrical. For this reason. Sometimes the losing of the volume is different in each hip. Actually, we're doing 8 sessions more or less. And I think next one, I think that the ultrasounds are very new and are very good to combine with radio frequency in body sculpturing patients. The degree of satisfaction was 4.8 in the group. There's no difference with the radio frequency that have this PrimeX with the other radio frequencies that have phase shifter that Almas provide, but this is a big difference with the ultrasounds. We are doing less sessions than we did with Prime ultrasounds before only, and controlling the dieting of patients. In my opinion, I think that this is the best body contouring platform that you can find actually in the market. When you have, I always tell to the doctors that come here to learn on this technology that it's necessary to have a body sculpturing unit in the clinic. It's necessary to have a dietitian. It's necessary to have people who are very good, who have a very big experience in the body sculpturing treatment with a very big experience in this device, and always you have very good results with this technology. Next one, please. So thank you, everybody, and it was a pleasure to collaborate with Alma. in the development of this kind of technology, and we have a huge work in the future because we have a new era about the use of the ultrasounds in medicine for body sculpture.
Thank you so much, Doctor. I have to say it's a pleasure working with you, somebody so professional, experienced and knowledgeable. And I mean, this paper just demonstrates on so many levels, scientific level, follow-ups. I think it answers a lot of questions that we get in the clinic on how this technology works. You know, does it work? What evidence do we have? And I think, you know, thanks to your study, you've really provided a lot of this information. Very, very impressive. And I can see we already have some questions. So let's take a look. So can you explain about the clinical effects of using impulse with the ultrawave? So that's a good question. What do you feel, Doctor, about the, you know, the introduction of the impulse feature? Do you use it? Do you not use it? Do you see superior results when you use this feature?
I think that we always use actually ultrasounds in all the patients, always. And I insist that echography is very interesting to do, to explain to the patient what we need to do. Because when you are doing the measurement of the fat panicle, you can explain to the patient that this fat panicle in the next measurement must be reduced. Okay, and because there are some patients who have a very big abdominal area and they have a very few panicle under the skin, and the most part of the fat are inside. And there are many patients who, after pregnant, for example, have diastasis of the rectus. Is a separation of the rectus that when the patient is stand up, this is open, and the abdominal area, you can see a big improvement of the abdominal area. But this is not about the fat that they have under the skin, because this is a muscular problem. So I think that diagnostic is very interesting, and day by day, the patients in aesthetic medicine would like to see what do you like to do. So you have after and before, and this is your panicle after and before. Okay, so if you have a right diagnostic in most part of the patients, much more important in the abdominal area, the results always will be okay. Think about that, for example, that we are using, for example, liposuction in the abdominal area. It's the same. It's necessary to do a very good diagnostic in the thickness of the supra and infra-umbilical fat, because it's much more safety for you. Because if you need to introduce a cannula in the abdominal area, it's necessary to know if you have an hernia or if you have, for example, a diastasis of the rectus. So the use of the echography in aesthetic medicine for that is totally necessary.
Yeah, no, absolutely. I mean, I really like that you use that for diagnostic. You're looking at the tissue, at the thickness, like you said, any hernias, any scar tissue. And I think this is a really important point. Talking about liposuction, we have some questions as well. Can it be combined with liposuction? Can you do a PrimeX treatment after liposuction? I mean, it's not instead of, in my opinion, but I do think that, especially with the tightening, maybe we can hear your opinion that it could definitely be in combination.
Okay, after liposuction, it's possible to do. We are using this after 4, 5, 6 months after liposuction, because we are doing a lot of laser liposuction here. There are some patients that after liposuction, they are a little bit touch up, for example, of the liposuction, that you can avoid with this technology, because it's possible to use this to do a little touch ups after liposuction. So It's very interesting that you told me that you speak before about that you told before about that there are some patients that the skin retraction is not perfect after liposuction, so it's necessary to use a technology that gives more skin tightening and more collagen in the area. It's much more important in the supraumbilical area because this is a conflictive area after liposuction. So it's possible to use after liposuction with or without ultrasounds if you need to reduce a little bit more of volume and if you need much more collagen. Think about that. The improvement of the collagen in all the patients has been very, very, very intensive. So I think that it could be helped to give to these patients much more tightening in the area.
Yeah, I mean, definitely. I've even spoken to some doctors that use PrimeX in combination with EMS, for example, because obviously this targets the muscle and they can't target, the tightening. So they would combine it with the PrimeX for really, all-round results. So definitely. Okay, I think what a shame we've run out of time, although I think we could carry on talking for a long time on this subject, but again I would like to thank you sincerely for joining us, for sharing your knowledge, describing your publication in such great detail, and I look forward to the next study, Doctor.
Thank you.
So yes, thank you everyone for joining, and questions can always be sent later on via email to me and I can pass them on. Thank you everyone. Have a great day.
Thank you everyone. Bye bye. Have a great day. Bye bye.
Bye bye.